Okay, today we're going to talk about the TPLO and cranial cruciate ligament disease. And the TPLO stands for Tibial Plateau Leveling Osteotomy. And that's tibial plateau, which we'll show you in a moment, leveling because we make it more flat, and osteotomy because we cut the bone. But before we talk about the TPLO, let's talk about the cranial cruciate ligament in general. This is a normal dog's x-ray. It's a lateral x-ray, and so we're looking at the side view of the dog. This is the femur or the thigh bone. This is the tibia and the fibula, and those are the shin bones. The ankle's down here. This is the knee, and this is the kneecap or the patella right here. And there's two cruciate ligaments, the cranial and the caudal cruciate ligament, and they live inside the joint. And the cranial cruciate ligament lives about like there, and the caudal cruciate ligament lives like that. And this cranial one is the one that's torn. And if we take a look, they cross, which is why they're called cruciate ligaments. But if you take a look at this top of this tibia, or this tibial plateau, it is actually slanted backwards. And so every time the dog walks and they put pressure on this femur, it wants to slide off the back of this slope. But this ligament acts as a tether to hold it in place, that cranial cruciate ligament. And one of the things you'll notice in a normal dog's x-ray is the back of the femur and the back of the tibia is all nicely aligned. If we compare that to a dog that has a cruciate tear in the same view, again, the femur, the tibia, the ankle, the knee, you'll notice the back of the femur and the back of the tibia are no longer aligned. We have this big step right here. And you'll also notice that here's our plateau right here. It's a little bit steeper than the other dog. All right. And so we have a couple of procedures that we can do to fix this, but I personally believe that the TPLO procedure is the best procedure out there to fix this problem. And we can do the TPLO procedure on almost any size animal, including cats. And they have a very, very good outcome with the TPLO procedure. It's my favorite procedure to perform. So with the TPLO procedure, which is the one we're going to talk about now, it stands for tibial plateau, which is this, leveling because we make it more flat, osteotomy because we cut the bone. And we're going to make a curved cut in the bone about like this. We're going to take this whole top part of the tibia and we're going to rotate it a very specific number of degrees based on our pre-op x-rays that we take. Once we get it rotated, we have to go ahead and put a plate and screws in there to hold things together. But we don't need this after the bone is healed because bone is one of the only tissues in the body that will heal back to 100% of its normal strength. So we leave this plate and screws in there. They get to be bionic essentially for life. And the studies show that we only have about a 5% chance of ever needed to go get those implants. So most of the time we just leave them in there. But post-operatively, this is actually what we're looking at. Okay? And so these are the same dogs pre and post-operatively, and these two. And what you'll notice is the back of the femur and the back of the tibia are in alignment again. And the top of our tibia, our tibial plateau, is much flatter than it was before surgery. And our goal post-operatively is about 5 degrees or so. In a normal dog, pre-operatively, Labradors are kind of the poster children for ACL or CCL disease. And when we see this, it's about 26 degrees in Labradors is the average. And so we take about 20 degrees or so at least when we do this procedure off of that tibial plateau. Here you can see the plate and the screws that go in there. And there's our cut right there in the bone. This is how far we had to rotate this dog, so it's a pretty good rotation. And that's what the TPLO procedure looks like post-operatively.